4. Supporting employers to recruit with confidence and create healthy workplaces. We want an economy where being disabled or having a health condition doesn't stop people from getting on in their career, and where businesses benefit by hiring the best people. We know lots of excellent employers recruit inclusively and help their employees stay healthy at work. We want more employers to act like this. It is in businesses' interests. We want your views on how to make this happen. The public sector is a major employer in its own right and must play its part. We will make sure public sector employers monitor and review their recruitment sickness absence and well-being activities and take action where issues are identified. Make sure all government departments become disability-confident employers by the end of this year. We will also expect other public sector employers to follow in the next 12 months. Use the public sector's purchasing and funding power to influence our suppliers and those who receive public funding to provide more opportunities and support for disabled people and people with health conditions to get into work. Talking about disability and health conditions. Employers can best help someone start or stay in work if they know about a health condition or disability. Many conditions are unseen, and a person may not want to tell their employer about a disability or condition. Employers may also feel uncomfortable themselves. Supportive conversations mean employees and employers can work together to help people fulfill their potential in work, and also mean that employers can understand the health situation of their workforce and put supportive measures in place. We need to see all employers creating environments where employees feel able to talk about health issues, and where employers act on that information to improve health. Making information accessible and linking employers. Lack of expertise, support, or capacity may stop employers from taking action on health and well-being. There is lots of information out there to help employers. We want to know how to make this easier to find and use. We will explore what a one-stop shop containing all this information could look like. We will also work with partners to run employer campaigns on key topics relating to health and work. Lastly, we want to build the business case for employers on investing in workplace health and well-being. Realising potential. Seeing more disabled people enter work is important, but it is not ambitious enough. We want to see these employees reach their full potential and secure senior positions. Support networks, such as the Business Disability Forum, play a big role in helping employers see the talents of employees with disabilities and health conditions. We will look to nurture employer networks where they can exchange new ideas and good practices. These networks could be just for employers, or also include employees and charities. We will set up a Disability Confident Business Leaders Group to increase engagement around disabled employment, starting with FTSE 250 companies. Incentives and innovation. We want to know if incentives help to encourage employers to try new things to support more disabled people and people with health conditions in work, or create new jobs. Several incentives already exist, and we want to know what you think about incentives and what type of schemes we should have in the future. Questions. What are the key barriers preventing employers of all sizes and sectors recruiting and retaining the talent of disabled people and people with health conditions? What expectations should there be on employers to recruit or retain disabled people and people with health conditions? Which measures would best support employers to recruit and retain the talent of disabled people and people with health conditions? Please consider the information it would be reasonable for employers to be aware of to address the health needs of their employees, the barriers to employers using the support currently available, the role a one-stop shop could play to overcome the barriers, how government can support the development of effective networks between employers, employees and charities, the role of information campaigns to highlight good practices and what they should cover, the role for government in ensuring that disabled people and people with health conditions can progress in work, including securing senior roles. The impact previous financial, or other, incentives have had, and the type of incentive that would influence employer behaviour, particularly to create new jobs for disabled people. Any other measures you think would increase the recruitment and retention of disabled people and people with health conditions? Should there be a different approach for different-sized organisations and different sectors? How can we best strengthen the business case for employer action? Moving into work. Employers can take many steps to make their recruitment practices inclusive to disabled people and people with health conditions. Advice on this is available on the Disability Confident website. The government has a number of schemes to support people into work, including access to work. Questions. How should we reform existing government schemes to help with recruitment of disabled people and people with health conditions? Do you have other ideas for reforming these schemes? Staying in or returning to work. When a person becomes ill, or their condition or disability gets worse, support from their employer can be the difference between them staying in work or struggling to cope and becoming unemployed. Occupational health services can help employers to support health and well-being, and help employees to manage a health condition or disability while working. But these services are not offered by everyone. We want to know how we can encourage employers to provide occupational health support. Sickness absence. Working flexibly for a while can help people manage or recover from a health condition and return to work. We know that some employers shy away from maintaining supportive contact with employees who are off sick. Statutory sick pay and fit notes can also put employers off talking to employees who are off sick, as they feel that these are fixed allowances of leave that people should be left to use up. It shouldn't be like this. Supportive conversations should happen anyway. Other countries require it. We want to reform the statutory sick pay system to better support these conversations and flexible returns to work. One option is to let employers top up the wages of employees returning on reduced hours, so that the employee still receives the same amount of money as they would from statutory sick pay. This would mean the employer would see more work completed for the same cost, and the employee wouldn't lose out by doing the amount of work they feel capable of doing. Income protection insurance. Employers can take out insurance to help them address the risks and impact of ill health. This is often called group income protection insurance. It usually includes actions to prevent ill health, specific support for employees and employers, and a payout after an agreed amount of time when an employee cannot work has passed. We think these policies have a bigger role to play in helping employers to invest in their workforce's health and well-being. Uptake of group income protection policies is low, particularly among small and medium-sized employers. We want to know why. Questions. What good practice is already in place to support inclusive recruitment, promote health and well-being, prevent ill health, and support people to return to work after periods of sickness absence? Should statutory sick pay be reformed to encourage a phased return to work? If so, how? What role should the insurance sector play in supporting the recruitment and retention of disabled people and people with health conditions? What are the barriers and opportunities for employers of different sizes adopting insurance products for their staff?